guys, and welcome back to this video, and today we're going to be talking about burns. So before we get into our burns, let's understand the skin here. As you can see, there's many facets to the skin and it's the largest organ in the body. But one thing I want to keep an eye on there is the subcutaneous tissue down at the bottom, and I'm going to talk about that in a minute. So there's different types of burns. You have thermal burns, you have electrical burns, you have chemical burns, and you have radioactive agents as well. So let's start talking about the different types that you may come across at home. So you have the dry burn, which is something you might touch with electrical, like electrical ring. You have the scald, which is a steam burn, or you're doing the wash up at home and next thing it splatters on your skin. We've all got a burn like that. Electrical burn, nasty piece of work as well, because remember, electricity likes the easiest route of resistance. So if you were holding something here, you put your finger out here, it can blow off the top or make a big hole inside your skin. Chemical burns. So I've often asked a question then, were you ever burnt by a chemical? Most people would say no, but you were. Nappy rash. So when you look at babies and they get nappy rash, but what is nappy rash? But it's urine, and inside it is urea, which is a chemical which burns your skin. Radioactive or radiation burns as well. Sunburn, you know yourself, here in Ireland we only get about 5 days of sun a year, and what happens, a lot of people head to the beach and then you end up getting with first and second degree burns, and we'll talk about that in a few minutes. Friction burns as well, where you go along and you burn yourself off a carpet, where you're scraping yourself, or off a belt of a machine, or if you're working with a mechanic and a fan belt is moving, you touch your hand, that's a friction burn. And the other ones then are cold burns as well. So cold burns is we don't suffer that much here in Ireland with them, but like if you have cold and your hand sticks to it, that's actually classed as a cold burn. So dangers of the burns then, we have to be careful, as I mentioned in one of my videos as well, critical incident stress management. We're looking at CISM, and you're talking about different things. So disfigurement, very nasty piece of work, guys, for a lot of people. You have scarring, people get nightmares, panic attacks, flashbacks, and also depression as well. So the seriousness of burns is most important. So like if we look at the face, in all my videos you notice I mentioned airway, breathing, circulation. So when you look at water, it boils at 100 degrees. A house fire can go from anything to 500 to 1200 degrees, and we'll discuss that later on down the road. So if you look at that immense heat coming into the nasal passage or the mouth, what happens, it can actually burn the inside of your mouth, while you may appear fine on the outside. So if you're dealing with somebody in a house fire, get your light out off your phone, look inside their mouth or look up their nose for soot or any kind of things like that. So that's the face, the head. We're looking at the hands as well, flexion points. So let's talk a bit about that for a second. If you go along and you look at skin here, so I have two pieces of meat, the exact same piece, came out the same package. One was heat was applied and the other it wasn't. So you can see what happens to the skin here, and that's only a percentage of the body, and we'll talk about that in a minute. That's absolutely horrendous, isn't it, when you think about it? So what happens out of that then is you can go along, if I got a burn to my arm here, the arm will tighten and I get a thing called a circumferential burn, where it goes all the ways around and it can actually cut off circulation to this point. So if I was to do it then with a rubber band, I put a rubber band on my hand here, and for argument's sake I move it back up here. Please don't try this at home. So you can see if I leave that here, what's going to happen beyond that point? So what's not going to happen is blood is not going to get up there because it gets very tight. Another thing we need to do is remove jewellery as fast as possible as well, because in case the hand swells, or if you got a burn to the hand, it doesn't go up along. So you have to be very, very careful about that. Obviously when you get to this level of a burn, most serious, anything other than a mild bit of sunburn, we need to seek expert help, because what's going to happen with this patient, they're going to be brought to hospital and they need to get an escharotomy done, which is where they go along and the surgeon or the doctor obviously are going to cut the skin here and here to leave the pressure off to allow blood to go in, and that's what happens in flexion points in the body. You can picture that, absolutely horrendous. So we have different types of burns. So they come in the old category, if you like myself, I always remember them as the first, second and third degree burn, but nowadays it's superficial, partial thickness and full thickness. So let's talk about the superficial one first, bit of sunburn. Most people has happened to, especially after the summer we had here this year in Ireland, we had about 5 good days, and people went off to the beach and people got roasted. Simple management, bring the person home, you go down to your local chemist, talk to them, get the after sun, spray it on the wound and everything can cool down, and you sit at home, you manage that for a few days. Anything that burns around as well, so a splash of water, you might see a small bit of redness, very painful. Cool the area down, make sure you cool it down. Superficial burns or second degree burns are very serious burns, because what happens now, you get burns, you get blistering as well. So when you're dealing with a patient, so be very careful as well, is that when you see blisters, instantaneously we have to be going to see medical expertise. Call an ambulance, or the person needs to go to the hospital, or go to visit your GP as well first. And always remember as well that if you're dealing with burns, it's like throwing a stone into a pond. So when you throw a stone into a pond, what happens? You get the rippled effect all the ways out. So if you have a 2nd degree burn here, you may have a 1st degree alongside it. So you have 2 burns, and the same as the next one we're going to talk about. A 3rd degree or full thickness burn, you can see it here, is basically it burns all the ways down along into the lower levels of the skin, and what happens is that's a very serious burn. What a lot of people will not complain of is pain, because what happens, the nerve endings have burnt out at this point, and it appears in different ways: waxy kind of skin, raw skin. You'll see it, it's white, it's very unusual, but very debilitating as well. Same principle again, if you have a 3rd degree, you're probably having a 2nd and a 1st alongside it as well. When you move along, then you can go into another thing called 4th degree burns as well, where the appendage may be burnt off. So let's talk about measurement of burns. So you've often heard that some people will say, like you see in the films, the doctor says, oh, there's 3% burns to the body, or 4% burns. In this particular case, how we measure is very simple. We look at the rule of palm, we call it. You can see it here. So what happens is that it's the patient's palm, not your palm now. Remember that. So if I came along to a small child, and hopefully you don't ever, and they have a small palm and 4 of their palms fit in mine, well, that means it's 4% burns. So what happens is if I came along to an adult of my size and I put the palm to palm, that becomes a 1%. So if I go along 1, 2, 3, so that part of my chest is worth 3% of burns. And it's a very handy way of looking at it. Burns to the airway as well. We discussed about house fires, making sure that you'll check inside the mouth. You'll move it on from there. So let's talk about our treatment. Most important now, tap. You need to get that burn in under a tap for about 20 minutes. What you'll find as well is a lot of people start saying, oh, it's very cold, but the minute you take away your arm, it heats up again. So remember when I said in the first video we talked about the adipose tissue, down here the subcutaneous tissue is the fatty tissue. So most people have eaten a toasted cheese and tomato sandwich at some stage in your life, or something like that. And what you'll notice, if you leave it on the plate for 5 minutes, the bread is cold, the cheese is cold, but the tomato is piping hot, isn't it? So imagine your skin is that way. So what we need to do is get the cold to go all the ways down in along. Another thing I'd advise, if you are cooling a person down alongside the tap, make sure you put something over their shoulders to keep them warm if they burn their hand. If you can't, if you're dealing with a lower leg or a torso, you can't get them on the tap, go to your shower, turn it on cold and leave it run. Also bring them outside to the cold outside tap as well, because what can happen out there is you can turn it on the whole body. Ideally, if you had a hat, put them on them, put a coat around them, but just to keep, that's what I would do when I treat burns inside my own job. Different things, we're looking at products here then. So you can see different products here. So we have the water gel, we have the burns gel, and also cling film thrown in the middle of that. Now the reason these are specifically designed for burns. So if you go along and you do anything like the old wives' tales where I put butter on it, put margarine, put toothpaste and other products as well, the only thing should be going on it is one of these products. And the reason being is if you put anything other than that on, it has to be scrubbed off. I've witnessed it with my own eyes. Absolutely horrendous, because remember, it's an open wound. So you put the water gel on, the burns gel on. Another thing then you're going to look at is the cling film. So when we talk about putting on cling film, when it comes out of the package, it's about, they say 98% sterile. And the reason being because it's made inside in a hot machine, and it's germ-free when it's rolled up. So when you open it, you're opening it new for the first time. So cut off squares. Don't wrap it around because of the circumferential burns. So cut off small layers, a layer one over another, and it becomes like an armadillo's skin. It slides over each other then, and that way then it will hopefully allow the skin to move ever so slightly. But remember, you're looking for emergency care at that stage. Okay, so let's have a quick recap. So tonight what we did is we talked about burns. You saw what happens from the piece of meat, what happens to your skin. We talked about circumferential burns as well. We talked about first, second and third degree burns, or superficial, partial thickness and full thickness burns as well, and the management as well. So thanks very much for looking at this video yet again, and if you do like it, please like and subscribe.